are with the another useful session of another useful and last session of Dr. Mohal Banker, who will guide us with magical formulas of how to treat elbow and wrist pain.
So this conference is planned in such a way that each session is designed in it's separated into three parts. One is imaging, how to imaging the joint. Then second part is how to treat it without any kind of invasive procedure, that is physical therapy. And our role comes when all this physical therapy fails. There are 90%, 80 to 90% we have seen that physical therapy works wonderfully, and within the time period is 2 to 3 months. If by taking the physical therapy for 3 months and if patient does not improve the pain, then we came into the picture. So these are tennis elbow and golfer's elbow. One is affecting the extensor group of the elbow, and second one is affecting the flexor group of elbow. And what if all this physical therapy fail? The guy is called Dr. 𝙂𝙧𝙗𝙧𝙪𝙡𝙀. He is an interventional radiologist, and he has published the first paper on this transcatheter arterial embolization using the imipenem for these tennis elbow, and we learn from him. So our target is chronic inflammation. This therapy is useful to reduce the chronic inflammation. By reducing the inflammation, we are reducing the pain and further damage. And actually the name is tennis elbow is really misnomer. It does not affect the only tennis player, but actually more and more affected the normal homemaker, housewife. They are doing the repeated activities and they are affecting their elbow joint, and they come with the tennis elbow complaint. So like this patient, a homemaker, develop elbow pain since last 3 years, severe night pain, not able to do routine work like making chapati, lifting tumbler, by taking bath. And we have done these tennis elbow embolization, and you can see over here these are pre-angiographic images, and these are extensor attachment over here. These are vascular blush. So these vascular blush is a 𝙂𝙚𝙗𝙪𝙡𝙀 blood vessels, which is a site of chronic inflammation. So once we identify this chronic inflammation site, we inject small embolizing particle. So main arteries remain intact, but these 𝙂𝙚𝙗𝙪𝙡 blood vessel will disappear by this procedure. And patient pain reduces by 70%. No night pain, sound sleep after the long time. The second, this patient has a 10-year-old trauma into elbow joint, developed fixed flexor deformity at elbow, developed pressure wounds at elbow, not healing since last 10 years. You are able to see in the X-ray also, there is a very soft tissue swelling, and there is a small pit over here. There is ulcer of the patient, and severe night pain. Taken so many antibiotic, other wound management treatment, but not responded. And these are fixed flexor deformity, and there is a wound over here. So what to do the next? Medical therapy, it was fail. He has spent lots of money for medical therapy. Tried surgical wound debridement, other wound management last 9 years. 9 to 10 years is very long duration. Most of the patient has tried all the things, all the duri, dhaga, or whatever the treatment available in our India. Everybody has tried, and this patient is really affording he has tried everything. He has to take painkiller every day to reduce the pain, not able to sleep with the painkiller because of severity of pain is so much. Then everything has failed in last couple of years. Patient suffering from a lot, and somehow by God grace he find it out, and we have tried the MSK embolization to reduce the inflammation. Let's see what are the finding. So if you are able to see over here, these elbow joint and these are vascular blush over here. The severe vascular blush, early venous drainage, which suggests chronic inflammation. And once we identify this chronic inflammation, and we started injecting the embolizing particle. So these are how it looks on the angiographic image. These are vascular blush, these are elbow joint over here, and the post embolization, these vascular blush disappear, and the normal vessels are still intact. So these treatment works wonderfully, and these are pre-embolization images. All these vascular blush, which is in Japanese language, it's called 𝙂𝙚𝙗𝙪𝙡𝙀 blood vessels. Why it's a 𝙂𝙚𝙗𝙪 blood vessels? 𝙂𝙚𝙗𝙪 means abnormal blood vessels, and these 𝙂𝙚𝙗𝙪 blood vessels are responsible for releasing the cytokines at the affected area, and these cytokines keep continuing chronic inflammation activity at the local site, and we are injecting the small particles which are exactly the size of these moya blood vessels, and by injecting it at the local site, we block these moya blood vessels, and the normal blood vessels, normal parent artery, are still intact, and by doing this we stop the in chronic inflammation at the local site. And let's have a results. Patient's pain started reducing, wound start healing within 2 months. Wound healed by 70%, patient's pain reduced by 70 to 80%. And when he came the first time, so there is a large wound over here and night pain, and after 2 months follow up, the ulcer size is reduced, which is very quietly visible on the follow up. Pain is reduced. Still I feel little bit warm. Me and Rosila have done the second sitting also, and now right now completely pain is gone. So don't rely only on medical treatment for chronic wound management also. If they are not responding, then go for MSK embolization. And MSK joint embolization technique is very helpful for many patients, and particularly if you have seen his conference like heel pain, Achilles tendinopathy, like tennis elbow, there are not much surgical options are available. For larger joint, for knee joint, there are option of knee replacement surgery is available. It's a last choice. But for such kind of ankle joint, many patients we have done with the chikungunya infection, they have ankle pain, and you cannot replace the ankle joint, but patient is still suffering from the pain. Like this patient is suffering from elbow pain since 10 years, and everything is tried but not responding, and all the joint pain, once if we confirm that there is a inflammatory pain, and if we apply this technique into that joint, then it is really helpful. One more important thing, many patients ask us that can we treat the back pain, or can we treat the sciatica pain? So I would always tell them that the origin of pain is different. When we are treating the sciatica pain, the pain origin is due to the prolapse intervertebral disc. So that is the neurological origin, and this treatment is not helpful for neurological pain. This treatment is helpful for chronic inflammatory pain. So particularly all the joint pains is can be treated with this MSK joint pain embolization technique. Thank you so much.